Dr. Turner, I realize that there's been a lot of new interest in aesthetics within the market segment that we refer to as gynecology. Why do you see that happening? What are the drivers that are occurring today?
I think it's primarily a financial one. Managed care has hit OBGYN probably harder than any other specialty. And they want to take such good care of their patients that they get rather frustrated with the time squeeze that you have, the numbers of patients that they have to see to make ends meet. And so they're looking for other things to do within the same patient set that they have that will benefit the patients and their bottom line.
There's been, at many of the meetings that we've seen, AORN, AAGL, a number of new market entry companies. What are those that you see that are of interest to this particular sector?
Well, the one that I'm most familiar with currently is a company called Sound Surgical Technologies, which have made some instrumentation to allow abdominal body sculpting, or actually body sculpting as a whole, for gynecologists. They've been in the plastic surgery market for quite a while, and just thought that perhaps it was a good fit for the gynecologist in practice. And I believe that's the case. The crucial things, the crucial issues here, I believe, are the fact that the American Society of Plastic Surgeons, in a practice advisory published a couple of years ago, stated that any board-certified surgeon could be trained to do liposuction within their area of expertise with appropriate training, and they set down guidelines for the training. For the gynecologist, that area is abdomen to mid-thigh, and I think it's a perfect fit for the gynecologist. They have the patient base for it, they have the patient trust, and they certainly have the skills to do that.
I'd like to get a little more definition on how you define the skill set for this particular sector, because in most cases, a lot of people are familiar with doctors delivering babies. And is there a particular skill set within this subset that makes sense for this?
Yes, absolutely. I think the gynecologists that are experts in laparoscopic surgery or endoscopic surgery are the ideal physician for this. They have good hand-eye coordination. They are perhaps a little more innovative than the average OBGYN, so they're a little more willing to take that step into the aesthetic market. And they are familiar with energy sources to a greater extent than the average OBGYN. And the equipment that I'm talking about, which is called a Vaser, is an ultrasound device that basically emulsifies the fat prior to aspiration, and it's done otherwise in a similar way to liposuction, but this is just a better technology. It's safer, it causes less pain, less tissue damage, therefore less pain and a faster recovery for patients, and it also allows a smoother result than the traditional liposuction.
I'm very familiar with the gynecologist who goes into a hospital setting or a surgery setting. Is this one of those models that would apply to those particular settings, or can this be done in the office?
No, I think the forte of the gynecologist is to be able to do this in the office under local anesthesia. It's much, much safer to do it under local anesthesia than general anesthesia. In fact, the risk of liposuction generally is 10 times greater in the operating room under general anesthesia or regional anesthesia than it is under local tumescence. Tumescent anesthesia is a method that was developed by a dermatologist now 20 years ago that allows dilute lidocaine to be put in quite large volumes in the subcutaneous tissue, which gives excellent pain relief for the patient, yet because of slow absorption, it is extremely safe. This medium allows the ultrasound, which is the basis of the Vaser equipment, to emulsify the fat and then allow gentle aspiration.
I wanted to ask you about the training that's necessary. Are there hands-on programs? Are there didactic programs necessary for this?
The American Society of Plastic Surgeons set out the training that they thought was appropriate, and that's pretty much what's been followed. It's they required eight hours of CME accredited course, including 3 hours of hands-on, and then some proctored cases afterwards. There's a lot to learn with this. I mean, this is a interesting technology, but gynecologists often don't have any familiarity with tumescent anesthesia and the fluid balances that are necessary to know, and the drug interactions that are important. But it's something that can be easily covered in the time, and that certainly laparoscopists has the skills necessary to do the procedure and can do it very well and very smoothly. The patient's very happy with the results, and the recovery's fast. It's much quicker than traditional liposuction. This is just a new, better technology. As we continue to improve surgical procedures, this is just another example of that.
It reminds me that there are certain questions that are being asked by patients. Why don't they go to have this done by a plastic surgeon versus a gynecologist? And you have a database, supposedly. Your patients are already there that would be candidates for this. Is that not true?
Yeah, that's absolutely true. This is where we should be getting our patients. Generally, the patients are very comfortable with their gynecologist. They may have been there, delivered babies for them, done surgery on them before, certainly seen them for annual exams, and they're very comfortable in that setting, and they're much more likely to come to their gynecologist to have this done than to go to a plastic surgeon, because we're talking about small procedures. And I actually canvassed my patients before I even did the training to do this. 20 patients that came through my office, I just said, what do you think about me doing this? And every one of them said that they would be more comfortable doing it there. And we certainly have the support of the plastic surgeons in doing this, because we can work in a symbiotic relationship with them.
Again, this is a procedure that can be done in your office.
In the office, local anesthesia, patient gets up and walks off the table, back at work in a couple of days.
Understood. Thank you very much.
Yep.